Well, state officials are sounding the alarm on a rising need for emergency service workers as call volume escalated from 2019 to 2022. The issue is multifaceted, but as Benta Boutier reports, the Indiana Department of Homeland Security hopes increased support through education will bridge workforce gaps.
You want the parts that go in your ear facing forward.
It's a Thursday morning at Tech Bloomington. About 10 students gather around a couple of tables and review how to check someone's vitals.
If you say 70, about 81. I have no idea.
Part of an emergency medical technician course, they'll take a test with Ivy Tech. If they pass, they can take a national exam. If numbers track with last year, they'll be among approximately 15,000 people who receive some type of EMS training and certificate in Indiana, including those renewing a license. But Keith Rademachir says that's not enough. Last year, there were more than 1.2 million EMS incidents in the state, and most people with EMS certification don't work in an ambulance. Rademachir has worked as a paramedic for decades and provides training at Ivy Tech. He says the need isn't new, but has become apparent with rising call volume in rural healthcare deserts.
The shortages are causing ambulances to go unstaffed or understaffed every day.
He says if the shortage continues, people will go without service for longer, waiting for an ambulance to be available.
What it really costs is time. Instead of a 5-minute response time, you may be looking at 20, 30 or longer.
Craig Kinney says the number of people getting certifications has remained stable over the years, but call volume increased by more than 30% between 2019 and 2022.
EMS has existed since the 1970s, and frankly, it existed and people just take it for granted. I'm going to call 911, I will get an ambulance.
He says turnover is higher in the profession now. People don't renew their certifications after 5 or 6 years. Wages and high stress, ambulance run reimbursement, and access to training have taken a toll. But now is an exciting time for EMS, Kinney says. It restructured last year at the state level and is now its own division under the Department of Homeland Security.
We get recognized by the legislature. We are closer with the governor's office.
And the state allocated $6.4 million for 2 years as part of the governor's Public Health Commission, which is something Kinney says it's never had before. One area of focus is tracking workforce data on EMS training and EMS incidents. The other is lowering barriers to certification through workforce readiness grants, about $1.4 million allocated for 2024 to covering student EMS coursework.
There are deserts where you can have 5 or 6 counties that adjoin that may not have any training that's provided, particularly at the paramedic level. A little more common at the EMT level, but there are still many counties that don't have EMT training.
Per the 2023 EMS Workforce Assessment, 61 of Indiana's 92 counties provide training. And the state EMS office is allocating another $1.5 million for equipment grants that training programs can apply for, with a preference to programs in rural areas. In the last 3 years, Ivy Tech Bloomington graduated around 230 EMTs and 30 paramedics. It has expanded its training out to 5 surrounding counties. Carly Wyatt says the funding for EMS education from the state is helpful in recruiting.
Students don't have to go into debt, and they can continue to get their education paid for. I think that that's a huge benefit, and it's a huge help to us in promoting our program.
For Indiana News Desk, I'm Benta Boutier.